At first glance, it seemed like an oddity, a quirk of fate, or perhaps a trick of perception. She walked into the room with a quiet confidence, her posture unaffected by the stares that seemed to follow her every step. Her legs, shapely and strong, caught the eye not for their grace, but for their unusual form. To some, they appeared almost animal-like, reminiscent of the sturdy, columnar legs of a goat. It was a sight that invited whispers and questions, the kind of curiosity that borders on concern. But behind this striking appearance lay a story far more complex and astonishing than anyone could have imagined. For much of her life, she had navigated a world unprepared for her difference. As a child, her legs began to change, first subtly, then more dramatically. While her upper body retained the familiar lines of youth, her lower half seemed to follow its own rules. Her hips, thighs, and calves grew disproportionately larger, while her feet remained slender and unaffected. No matter how much she exercised or how carefully she watched her diet, the transformation continued. Doctors were puzzled, friends were sympathetic, and she herself felt trapped in a body that defied explanation. It wasn't until much later, after years of searching for answers, that she finally discovered the truth. She was living with a condition called lipedema. The revelation was both shocking and liberating. Lipedema, a chronic disorder that predominantly affects women, causes the abnormal accumulation of fat beneath the skin, typically in the legs and sometimes the arms. Unlike ordinary weight gain, this fat is resistant to diet and exercise. It accumulates in a distinct pattern, often sparing the feet and hands, leading to the characteristic column-like appearance of the limbs. In her case, this manifested as what some described, with a mixture of fascination and insensitivity, as goat legs. The journey to this diagnosis was anything but straightforward. Lipedema is a condition shrouded in mystery and misunderstanding. For decades, it was often misdiagnosed as simple obesity or mistaken for lymphedema, a different disorder involving fluid retention and swelling. The lack of awareness among healthcare professionals left many women, like her, feeling isolated and misunderstood. The stigma of having a body that did not conform to societal expectations only added to the burden. But recent years have brought a wave of progress. Advances in medical research have begun to shed light on the true nature of lipedema. New imaging techniques now allow doctors to distinguish lipedema from other conditions with similar symptoms, providing a clearer path to diagnosis. Where once there was only confusion, there is now the promise of understanding. Researchers have identified several key characteristics that set lipedema apart. The disease almost exclusively affects women, and often appears or worsens during periods of hormonal change, puberty, pregnancy, and menopause. This has led scientists to suspect that hormones, particularly estrogen, play a significant role in its development. Yet, the exact cause remains elusive. Genetic factors appear to be involved, as lipedema often runs in families, but no single gene has been identified as the culprit. With diagnosis comes the question of treatment. For years, those with lipedema were told that little could be done. Standard weight loss strategies, dieting, exercise, even bariatric surgery, proved largely ineffective against the stubborn fat deposits that define the disease. The sense of helplessness was profound. But today, a new era of treatment is emerging. Conservative therapies form the first line of defense. Compression garments can help manage discomfort and swelling by improving circulation and supporting the affected tissues. Manual lymphatic drainage, a specialized form of massage, can alleviate symptoms by encouraging the movement of lymph fluid, reducing pain and heaviness. These approaches do not cure lipedema, but they can significantly improve quality of life. For some, however, conservative measures are not enough. In such cases, surgical intervention may be considered. Liposuction, once viewed with skepticism, has now gained acceptance as a legitimate and effective treatment for lipedema. Unlike cosmetic liposuction, which targets superficial fat for aesthetic purposes, lipedema liposuction is a medical procedure designed to remove the abnormal fat deposits that cause pain and mobility issues. Studies have shown that this approach can reduce limb volume, alleviate discomfort, and slow the progression of the disease. For many women, it offers new hope, the possibility of regaining not only their mobility, but also a sense of self that had been eroded by years of struggle. Yet, liposuction is not a cure. Lipedema is a chronic and progressive disease, meaning that management is ongoing. Even after surgery, patients must remain vigilant, continuing with compression and other therapies to maintain their results. The journey does not end with a single procedure. It is a lifelong process of adaptation and self-care. The impact of lipedema extends far beyond the physical. Living with this condition means navigating a world that often fails to understand or accommodate difference. The emotional toll can be immense. Feelings of shame, frustration, and isolation are common. Many women report experiencing depression and anxiety, exacerbated by the stigma attached to visible differences in body shape. Relationships can be strained, careers disrupted, and self-esteem undermined. But amidst these challenges, there are stories of resilience and empowerment. The rise of online communities has given women with lipedema a platform to share their experiences, find support, and advocate for greater awareness. Social media campaigns and patient organizations are working tirelessly to educate the public and the medical community alike. Their message is clear. Lipedema is not a personal failing, nor is it simply a matter of weight. It is a legitimate medical condition that deserves recognition, research, and compassionate care. The story of the woman with goat legs is, in truth, a story shared by millions of women around the world. Estimates suggest that lipedema may affect up to 11% of women globally, though the true number is likely higher due to underdiagnosis and misdiagnosis. Each individual's experience is unique, shaped by genetic, hormonal, and environmental factors. But the common thread is one of perseverance in the face of adversity. Recent developments in the field of lipedema research offer hope for the future. Scientists are delving deeper into the molecular mechanisms that drive the disease, searching for biomarkers that could enable earlier and more accurate diagnosis. Clinical trials are exploring new therapies, from medications that target inflammation and blood vessel health to novel surgical techniques that minimize risk and maximize benefit. The goal is not only to manage symptoms, but to halt or even reverse the progression of the disease. The medical community is also beginning to recognize the importance of multidisciplinary care. Lipedema affects the body in complex ways, and effective treatment often requires the expertise of physicians, surgeons, physical therapists, nutritionists, and mental health professionals. By working together, these specialists can address not only the physical symptoms, but also the psychological and social challenges that patients face. Education is a critical part of this effort. Healthcare providers need better training to recognize the signs of lipedema and to differentiate it from other conditions. Early diagnosis is key. Intervening before the disease progresses can make a dramatic difference in outcomes. Patients, too, need access to accurate information and resources to empower them to advocate for themselves and make informed decisions about their care. The story of lipedema is not just a medical one. It is also a social and cultural one. Our perceptions of beauty, health, and normalcy influence how we see and treat those who are different. For too long, women with lipedema have been judged and dismissed, their suffering minimized or misunderstood. Changing this narrative requires not only scientific progress, but also empathy and respect. As awareness grows, so too does the possibility of change. More and more, people are coming to understand that bodies come in many shapes and sizes, each with its own story and challenges. The woman with goat legs is no longer a curiosity or a cautionary tale. She is a person deserving of dignity, care, and understanding. Her journey continues, as does the journey of countless others. Living with lipedema requires courage, the courage to seek answers, to advocate for oneself, to challenge stereotypes, and to hope for better days ahead. It is a journey marked by setbacks and triumphs, by moments of despair and of hope. Every day, new stories are being written. Women who once hid their legs now walk with pride, supported by communities that celebrate their strength. Researchers who once overlooked the disease now dedicate their careers to unraveling its mysteries. Families who once struggled in silence now find connection and understanding. The reason for her goat legs was indeed shocking, not because it was sensational, but because it revealed the profound gaps in our knowledge and compassion. Lipedema is a reminder that the human body is wondrously complex and that health is about more than outward appearances. It challenges us to look beyond the surface, to ask questions, and to seek understanding. The path forward is clear, though not easy. Continued research is essential to uncover the causes of lipedema, to develop better treatments, and to ensure that no one suffers in silence. Advocacy is crucial to demand recognition and resources and to challenge the stigma that surrounds visible difference. And above all, empathy is needed to listen, to learn, and to support those whose journeys may be different from our own. In time, the story of the woman with goat legs will become just one chapter in a much larger narrative, a story of discovery, progress, and acceptance. It is a story that reminds us all that every body has a reason for being, and that understanding those reasons can lead to healing, hope, and a more inclusive world. Lipedema is not a rare curiosity or a medical oddity. It is a significant public health issue that deserves our attention and action. By embracing the latest scientific advances, supporting those affected, and fostering a culture of acceptance, we can ensure that the shocking reason behind her goat legs is met not with fear or ridicule, but with knowledge, compassion, and the promise of a better future. As she continues her journey, she is no longer defined by the shape of her legs, but by the strength of her spirit. Her story is a testament to the resilience of those who face challenges few can understand, and to the power of science and society to change lives for the better. So the next time you hear the phrase, "she had goat legs," and the reason will shock you, remember that the real shock is not in her appearance, but in the incredible journey that lies beneath. The journey of discovery, struggle, and hope that is redefining what it means to live with lipedema. And remember, every story of difference is, at its heart, a story of humanity.